talk about retractors just for a minute. A lot of practices only buy these wire retractors. A couple of things that I don't like about it is the fact that, first of all, if you have restorative, like I do, this is like nails on a chalkboard. The other thing is that these are cold, but let's talk about the most important thing here. When we slip these in the mouth, and I'm going to use a small end collie because we're just going to just kind of demo. Close just a little bit for me, and I want you to hold those, okay? You got them? All right. What happens to the lip? And I want you to be straight across so this way we can see it. Pull it up just like that. And give me a smile. Do you see what happens to the lip? It's like a roller coaster. And the same here, okay? If we were trying to have an aesthetic case and we wanted to do some gingival contouring, boy, it'd be hard to get that, okay? So I'm going to take those out, and I'm going to show you why we like these. These retractors have two different ends. We've got a C end, and we have a Y end. You see that? Let me show you the difference of why these are so much better. So Kylie, lift your lips really good. Just lick them. There we go. And I'm going to slip these in. Now I'm going to use the larger end for Kylie, even though she's younger. Okay, and I want you to hold those for me. Got it? Look how much better. And my eye doesn't go to the wire. My eye is really going to be focused on her teeth because no distraction. Not blue, definitely not red retractors. We want something that's very, very clear, okay? So Kylie, hold your head up just a little bit for me, and I want you to close ever so slightly. Keep closing right there. And notice too, sometimes patients will pull them back. We really want you to pull them forward. What that does is it really opens up the buccal corridor. I can see straight down, okay? So just like that, and I'm going to pull up my camera, and I want you to close just a hair. Keep closing right there. I only want a space, and the other thing is that I want to see those incisal edges. This is important when, again, we're looking at those edges for wear, incisal translucency, anything but the lab, this is vital. So I am going to come right in again, dead on, zoom in, listen for the beep. Beautiful. I have a little bit too much of an opening, right? I like for her to close just a hair more. I mean, we're being picky here, but I want you to be instructed on the best photos you could take. So Kylie, again, you've been so great. Lift your chin just a little bit. Stay just like that. And I want you to close just a hair, close just a hair. Right there. Perfect. Beautiful. Look real quick here at the difference, okay? See the space ever so slightly, but it does mean a lot. So the next thing I'm going to do is I'm going to have you bite together. Again, same thing. I'm going to come in and go like this. There you go. Pull that tongue back. I don't want the tongue in the way because what happens is I see the saliva and everything else through it, okay? The other thing is encourage patients to stay biting together. You heard me say that because what happens is starting to get tired, which she is, and they'll open. Take those out. There we go. And again, this is really important when we think about our buccal shots. I don't like to use a buccal mirror and having to go through all of that if I can get everything I need with these retractors. The other thing is Kylie's going to notice that we didn't quite over her up quite as much, so she might like me more by utilizing these. Now, I wouldn't do that on an adult. So we're going to slip these in, and Kylie, I want you to lick your lips for me again, and we're going to slip those in, okay? Good job. A lot easier, isn't it? Hold those right there for me, okay? So what I'm going to do now, this is called a lateral shot, and all I want to get is just the lateral in the frame. And I want you to say just like that for me. Pull that tongue back. So I'm going to come in and just get my lateral shots again. It's repetition. So once we've got those, I want to just show you 2 more shots and we're going to be done. So using the Y end, again, going back to the buccal views, slipping those in, okay? Kylie, you're such a pro now. Holding them out, a couple of things all the way to the end, okay? Remember, the further away from the mouth, more stability you're going to have. So coming out, okay? And now what I want to do is let's talk about the buccal views. I'm going to have Kylie turn her head, okay? And I never want to just let a retractor go. If we took this one out, hang on to this one, okay? And we just let it go, what happens to the mouth, right? It collapses. So you always still want to have two retractors in, but we don't have to pull quite as hard on this side, okay? Just kind of hold it over here, but don't go Don't pull it too much, okay? I want you to be as comfortable as you can. Turn your head. Now, profile shot, what you are going to do is she's going to pull this back to her ear. It's almost like, again, a buckle shot is almost like a profile, okay? So, Kylie, I want you to bite all the way together and hold it. So notice here that the retractor is straight across. If it's up at an angle, guess where you're going to be? At an angle. So I want to make sure that I have the same. And lift your chin just a hair. Bite all the way together. I'm going to come this way. Beautiful. All right, let's do the other side. And straight, remember, straight back, not forward. Make this one relaxed. And pull all the way back for me and bite down. Okay? And pull that tongue back. Good job. And sometimes I'll like to just really get in there just because of her bite. I'll come forward just a little bit just so I can see a little bit more. Wonderful. Take those out. There we go. And again, C and the Y. These are really important, okay? Further outside the mouth, the more control we have, right? Now, there is two other things that I want to share with you. Again, don't have to do these. This is just what I like to do. When we're putting the retractors, and we'll talk about that a little bit later in the autoclave, if we don't put them in our bags and then put them in the top, very top of the autoclave, what will happen is they'll start to get foggy. They'll start to get a little nasty, and patients sometimes will say, are those clean? So you probably already have those. You're like, Shannon, we already have a pair of those. We want to toss them and buy some new ones, okay? They're so cheap. But a really good friend of mine, his name is Milos, he actually has a website called Ugly Tooth, which we'll have at the end, I'll show you. But these are his really developing these. I think are really cool, but first of all, you don't see that scratch. We don't use them all the time because remember I said you don't want anything distracting because if you're using red, blue, I've seen yellow, believe it or not. But this is kind of cool if you're really looking to take some other images. And so I just want, just for a second, and I know Kylie's getting tired, but I just want to show you that really quickly because she's been such a trooper. But look at the difference with these. I love these. Kind of cool, huh, with my black gloves. But take a look at those. Might be something that you may be interested in. And again, I like them, all right? Thank you so much, Kylie. Again, further outside the mouth, same length. And I like because he has a Y and a CN. So again, the theory is the same.